So, welcome everyone. Myself, Dr. Jibran Ahmad. I am the creator of Simply Pathology. And in today's session, it is a very interesting session wherein we are going to discuss about the approach towards the first year residency of MD or DNB pathology. Okay. So we have to discuss very important points because you are here for the first time, and because the pathology department is a new department for you, and whatever ideas that you people are having, whatever ideas you people are having with regards to
Whatever MD
ideas you
pathology.
have with regards to pathology, okay, with respect to whatever you have learned in your second MBBS, okay, and whatever you see in your residency life, whatever you see in your residency life, okay, that is in your MD DNB. So there is a lot of difference. So there is a lot of difference. There is a huge leap. Okay. So whatever idea you are having about pathology in your second MBBS and whatever you come and see in the residency life, okay, it is quite different. And because of this situation, okay, there is a shock actually when you enter pathology. So regarding pathology, I would just like to say you something that pathology, if you see as a subject, okay, pathology as a subject, if you see, it is neither fully clinical, okay, it is neither clinical nor it is a non-clinical branch. Rather, you will sometimes feel as a clinician and sometimes you will not feel as a clinician. So we call it as a paraclinical, we call it as a paraclinical subject. Pathology is a paraclinical subject. Okay. So it is neither completely clinical, neither it is a non-clinical branch. Now there are certain things that you have to keep, okay, as a first year resident, there are certain things that you have to keep in your mind. You have to first understand that what is the requirement out of this particular residency. What is it that you should be able to do at the end of the residency? So this orientation, many people are not having. So you have to understand, and this has to be very clear, that pathology, it is a dependent branch. Pathology is a dependent branch. What do you mean by it is a dependent branch? It means you have to depend on the clinicians. You have to depend on the clinicians, okay, for getting work, for getting good work. Understand what I am saying? Now, to illustrate, my saying with the help of an example, let me tell you. So, for example, a patient has come. Okay, a patient has come with a breast swelling. So initially, the patient is not going to come to a pathologist with a breast swelling. No, the patient is going to first go to a clinician. Okay. And the clinician, after examining the breast swelling, will advise a study that is called as FNAC. So I hope you all know what is the meaning of FNAC. It is a fine needle aspiration study. So those of you who have joined MD Pathology and you have rotated, through your cytology posting, so I hope you know what is the meaning of FNSC. It is a procedure which is done, a needling procedure. So once the clinician is going to write FNSC, only then that case is going to come to the pathologist. Now you have to understand what is the role of a pathologist over here. Now, for example, if the breast swelling, the pathologist has done the FNAC and in the reporting, for example, he has given the diagnosis as fibroadenoma. In that situation, if the pathologist has clearly written that a particular case cytomorphologically it is consistent with the diagnosis of fibroadenoma, then the clinician will be relieved. So will the patient, because fibroadenoma, it is a benign condition. Unless and until it is quite large or disfiguring, usually we go for a wait and watch policy for fibroadenoma. Similarly, if that particular breast swelling, okay, it comes out to be an infiltrating ductal carcinoma. Again, this diagnosis becomes very important for the clinician. So if it is an IDC, straight away they will go for surgery and radio chemotherapy. Okay, they will go for radio chemotherapy. So the role of a pathologist, okay, it is very much important to the clinician. So you have to prove your worth to the clinician actually. So you have to be useful. If, for example, instead of fibroadenoma, if you overdiagnose the case and overdiagnose the case of fibroadenoma as an IDC, or if you underdiagnose the case of IDC as a fibroadenoma, then will any clinician send that particular case to that lab or to you as a person? No, he is not going to send. So you have to be useful. You have to prove your worth. You have to be useful to the writing clinician. So this ideology have to be very clear in your mind. Pathology is a dependent branch. Okay, it is a dependent branch. We are dependent on the clinicians for the cases. Having said so, I am not taking out any kind of any kind of down or any kind of bad thing. I'm not saying anything bad about our subject. No, but I am trying to tell you that what are we and what is the practicality of our branch. So I am trying to train your mind in that particular way so that from the first year, you start to become useful to the clinician and you start to think as a pathologist. So when you are going through this MD pathology, you have to be very sure what is required out of you. You have to give a diagnosis to the clinician. You have to give, you are like a detective over here. You have to give something useful to the clinician with which the patient can work, with which the clinicians can work. So you have to be useful in that. So unless and until, so see, when you apply for a job, okay, they write down what is the job description. Yes or no, everyone? When you apply for a job, any job, they will write you a job description. But when we are joining MD pathology, no one is teaching us the job description. So what is it that is required out of a pathologist? So this is just a very basic thing that you have to understand. Okay, is this very clear to everyone? Okay, any doubts till this point? So I hope everyone has understood that what is your role in the society for the patients and for the clinicians, where you are standing. So you have to work over here and you have to hone all these skills to make these diagnoses possible. Understand? This is just a basic example that I have told you. Okay. Now coming over here, what is it that you are going to do in your first year? Okay. So this is the first year. So first year MD pathology. I have often seen in the first year MD or DNB pathology, I have often seen many seniors, or I have also seen many professors, many teachers, okay, who are actually there in your colleges. They just say, "Oh, this is the first year." No one is not going to give you importance. Okay, so there are lots of myths. Number one, you should not think that the first year is not important. In fact, if you ask me, first year is the only time that you are going to get to cover the most basics and the most important portions of your syllabus. In fact, the first year is the only time that you are going to get to build your basics. So I agree with you on the fact that as a first year, you are not given much of importance. No one gives you any kind of importance because you don't seem to be that much useful. You are new over there. Okay. So you have to take down orders from the second year, who is taking order from the third years, who itself is taking order from the demonstrators, assistant professors, associates, then professors, then HOD, and HOD is taking orders from the head of the institution or the MSVP, whatever is the hierarchy. I understand that, and you all have understood this thing. But always remember, you as a first year resident, you are very, very important, not for other, but for yourself, for your understanding. This becomes very, very important. Okay. Is this very important for, is this very clear to everyone? Okay. Okay. Everyone, can you see the screen? Is my voice audible to everyone? There is no problem. Yes.
Yes, sir.
Okay, good. Okay. So where are we? We are over here that although no one is not going to give you that much of importance in the first year, but you are important for yourself. Because if you do not give importance to yourself, you will have a very hard time in the second and third year. And those are the years where you should excel. Those are the years where you should enjoy. First year is the time where you have to work on yourself. This is very, 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 very important. No one doesn't understand this. It is also the time, okay, it is also the time, the first year is also the time where you get to acquaint yourself. Okay, you have to acquaint yourself with the different sections or the different departments, okay, or the different portions or the different rotations. Okay, you have to get yourself acquainted with this. For example, you should acquaint yourself with what is grossing, why grossing is done. You should acquaint yourself after grossing. There is something called as tissue processing. Yes or no? So you have to acquaint yourself. What is tissue processing? After tissue processing, what is happening? Then you are also going to have the staining process. You have the staining process. After the staining process, then the slides are made. Section cutting is happening. Everything is happening. After that, the slides come to the microscope. So the microscopic evaluation, and after that, the microscopic evaluation, okay, then you are having a particular report. The reporting is there. Yes or no? Then in certain situations, you have to go for certain special stain. Sometimes you have to also go for immunohistochemical evaluation. So there are different, but this is the basic rotation where, this is the basic things that happens, okay, in your first year. Along with that, you are also posted in your central pathology or central lab duties, that is the hematology duty. Then you also are having cytology as well. So what is happening that in the first year, you have a lot to take in, and I agree it is very difficult to understand each and everything. Now there is a system in place, and suddenly you are expected from the very first day that you are a part of the system and you should know everything. One very bad thing that happens in the first year is that each and every professor and each and every, not all of them, but few of the professors, they think that the first year should know each and everything. Because you are new, you will take some time to acclimatize. But that time is not given to you. It is expected from the very first that you should know each and everything. And I agree with you, it is not your fault. But yes, if you are not acquainted at the end of the first year, and in the second year, if you are making some blunder or some mistake, then it is your fault. First year is the time where everyone tells you, "Arey, first year is nothing, you don't," because it is not the way it seems. The seniors will say, because they have not done anything, they will expect that the juniors will not do anything. You will expect that your juniors will not do anything, and that is completely wrong. First year is a time that, where you have the maximum amount of time available, least amount of responsibilities in the departmental work. So you have the maximum time to prepare for your exams, to prepare for yourself, to prepare your basics. People, if you are not using this time nicely, I'm very sorry to say, you are wasting your time. Now, I think you have already spent 6 months. Someone has spent 3 months, 4 months. It's all right. Even whatever remaining time is there, 6 to 8 months of time is enough to excel your first year. Okay. So it is very, very important. Let me just start with what you should do in the first year. As I have repeatedly said one thing again and again and again, the first thing that you should always start, I have been repeating this again and again, is to start Robbins. At least cover the first 10 chapters of Robbins. You have access to the website, you have access to the notes, you have access to everything. You just have to take your time out. You have to see 1 hour video every day. Is that a very difficult thing to do? If you are constant, okay, if you have a consistent approach, if you are consistently, even if you watch my videos of general pathology 3 days or to 4 days a week, you will complete all the pathology general pathology videos in approximately 3 to 4 months of time. That is all the amount of time that is required to complete Robbins. You have access to the videos, you have access to the PDFs. The only thing that you have to do is to eat. Okay, already the food has been prepared for you. Okay, already it has been made tasty with good concepts. Okay, you just have to listen, and you just have to, when you are watching the videos, you have to correlate with the notes. That is it that you have to. It is not going to take more than 3 to 4 months of time to understand it. Why am I telling you that Robbins first 10 chapters are important? Why is it that I am telling you this thing? Why? Because your basics will be formed via this. If this is not clear, then 110% I'm telling you, you will not be able to understand any other things. You agree with me or you not agree with me? Robbins is forming the basis. Robbins is forming the basis of pathology, and you have to understand one very important aspect. The aspect is that you have to 110% you have to read Robbins. I'm telling you again, again, again. And what is very important, just reading Robbins is not going to solve your problem. No, just reading Robbins is never going to solve your problem. You have to read and revise. So this is the ultimate number one goal for you as a pathologist. Because if you don't read Robbins, then I'm very sorry to say the further steps are not, how should I say, the further steps that you take, they are not correlated. So Robbins is important for correlating the basics, number one. Along with that, what is very important, as I've already told you, is to go through normal histology. Now, I will tell you something. As a first year resident, I have seen majority of the students, they want to see all the difficult slides. They want to see some rare diagnosis. They think that after looking at the rare diagnosis, they will become a good pathologist. No. The most important thing that a pathologist can do is to differentiate between a normal and abnormal slide. It is to differentiate normal versus abnormal slide. And this is the thing. This is the thing. This is the actual work of a pathologist. Now, when you go outside for working, when you work in a laboratory, when you're going through the histopathology slides, okay, in that situation, you will see that out of 50 slides, 40, more than 40, 45 slides out of 50, or more than 90% of the slides, they are actually benign. There is no abnormality as such. It is a usual situation, a usual condition. So you have to separate those conditions from the malignant conditions or from the bad conditions. So from the abnormal conditions. So how are you going to do that? You can only be able to do that only if your normal histology is clear. I know that all of you know this, but how many of you have applied this knowledge? How many of you have applied this? Now, for that, what is the approach that we are going to take? First of all, let me tell you, as I've already explained in the orientation video, Wheaters is the ultimate book that you have to see. You don't have to read each and every line of Wheaters, but at least what you can do, that you can go through the images in the Wheaters. You open one chapter, you at least go through the images of Wheaters. Now, what we are going to do at Simply Pathology from our end, what we are going to do, that in this dedicated first year MD Pathology group, we are going to start again certain normal slide discussions. What is the meaning of normal slide discussion? So for example, I will give you a normal slide of the thymus. Okay, I will give certain, whatever slide pictures I'm going to give you, they will be significant. There will be 5-pointer discussion. 5-pointer discussion means there will be 5 important points that you have to recognize in that particular slide so as to understand why is it thymus and why and what it differentiated from other organs and how it is to be differentiated from the tumors. Okay, so this is the 5-pointer normal slide discussion that we are going to start in our first year MD pathology group. This is something that we are going to start from this year. Okay, is this very clear? This is what we are going to start, because you have to understand the normal histology so as to understand the abnormal histology. Is this very clear to everyone? Okay. So after this, after the normal histology, what we have to understand, the second thing that is there, every day that you are going to the college, you should see common HPE slides. Now, what do I mean by the common HPE slides? Common HPE slides, for example, you can also, there is another version of Wheaters, which is Wheaters histopathology. So which common HPE slides I want you to see and understand? For example, you see a slide of appendicitis. Okay. You see a slide of chronic cholecystitis. You see a slide of endometrial biopsy. Endometrial biopsy, or for example, there is a uterus, there is a uterus, and then you have given different sections from the endomyo. So I want you to appreciate the endometrial lining. Understand, you see the endometrial biopsy or you look at the uterus slides. I want that you appreciate how the endometrial lining looks like. What is the normal lining of the endometrium? You see under the slide, because these are some of the basic diagnosis that is happening. So in the appendicitis, why am I calling you appendicitis slide? Can you see a normal appendix slide over there? No. Only when a person is having appendicitis that you are getting a slide. So I want you to go and appreciate the lining of the appendix over there. I want you to go and see what are the structures defining the gallbladder, or what do you see in the chronic cholecystitis. Similarly, looking at the endometrial biopsy, you will be able to understand what is endometrial dating. Okay, what is a proliferative endometrium, what is a secretory endometrium. So you will be able to understand those features. These will be discussed also in your first year MD, MD DNB group. We will discuss these basic things. So every day you have to go and see the common HPE slides. I hope you have understood. For example, one of the common HPE slides is neurofibroma. Why am I calling them chronic HPE, common HPE slides? Because these come on a day-to-day basis. Okay, and whenever you are going to start your practice, okay, you are going to come across these slides first, and you are going to have, you are going to see these slides, a lot. Every day 5 to 6 such cases will be there. So what is the idea behind it? It is to make your eyes ready for these normal slides, so that you understand how does a normal cell, how is the normal configuration, what a normal nucleus looks like. Okay, you also have to appreciate, okay, blood vessels in your slide, nerves in your slide, fat tissue in your slide, all the basic structures. What is the lining epithelium? In any slide, there will be a lining epithelium. So these are the basic things that you have to appreciate while you are appreciating these common HPE slide that is being reported. Understand? Again, one very common slide is ectopic pregnancy that you see. Okay, or for example, hydropic mole, H mole that you see. Okay, that is also commonly encountered over here. So you look at these basic slides, which usually did not come for your exams, but they are quite important for developing your skills, your histopathology skills. Okay, along with the common HPE slides, again, you will have to go across common cytology slides. Common cytology slides. So what are the common cytology slides? What do I mean by that? For example, if there is a granulomatous lymphadenitis, so you should be able to identify what is a granuloma. Very important. For example, there is a slide of fibroadenoma. You should be at least able to understand a fibroadenoma slide. For example, some basic slide like neurofibromatosis or ganglion cyst, okay, neurofibromas, ganglion cyst, etc. Okay, lipoma slide. So these are some of the common slides that is getting reported. So you have to lay more stress on recognizing these normal slides. Why am I telling you that? Once you develop eyes for looking, so when you are actually using the microscope and when you are examining a slide, you're also developing the skill how to examine the entire slide. Okay, how to not miss each and every feature, how to see the different features that you are seeing, in a particular slide, how to see those things. Now, if you ask me personally, what I used to do in my time, I used to examine 5 slides every day. Okay, it is not a hard and fast rule that every day of your residency you have to examine 5 slides. Sometimes I used to see some of my colleagues in my time. I'm not criticizing anyone, but I'm saying you that they used to sit with around 15 slides, 20 slides, 25 slides. No, it is not the number of slides that is important, but it is the type of slide that you are watching that is important. Understand? So if you are looking at 5 slides every day, so for example, one of these slides you have seen appendicitis, once you saw the cholecystitis. Now, these are very easy diagnosis. But for example, you have to appreciate whether in the chronic cholecystitis, whether you can see the Rokitansky sinus or no. Whether in appendix slide, can you recognize the Peyer's patches or no? What is the lining epithelium or no? So these are the few things that you have to appreciate. For example, you have seen a case of infiltrating ductal carcinoma of the breast or IDC breast, or you are looking at the uterus cervix slide. So in the uterine slide, you have to see, you have to comment. Okay, you have to sit and comment that whether that particular slide, if it is a proliferative endometrium or it is a secretory endometrium. So by yourself, you start to comment. Okay, you see whatever you are looking in the book and whatever you are reading, whether it is matching or no. Okay, similarly, one more thing. So this is the way that you should see. Now, just looking one slide of appendix, one slide of cholecystitis is not going to solve your problem. You should see that again, till you become confident enough to understand, okay, now I'm confident with this. Understand? So 5 common slides you have to see every day. Make it a point. It is not a hard and fast rule that every day dekhna hi hai. But for example, out of 6 days that you are attending, at least if in those 4 days, out of the 6 days that you attend, if in the 4 days you can see 5 slides, 5 good slides, okay? And always remember, it is not like, if you are missing some slide, if someone has seen some case, then, uh, and you have not seen, then that is the end of the world. Don't feel like that, please. Don't do like that. Okay, this is very, very important to understand. Okay, so is this point very, very clear? Common cytology slides, common HPE slides. Now, along with that, I wanted to discuss the common hematology slide, but that I am going to discuss mainly under the section of clinical pathology, which is the next point of discussion. So before I go into the next point, I am just going to revise what we have read till now. I have just made you people understand that as a pathologist, what is your work? What is your role? What is your job description? It is a dependent branch, and you are answerable to the clinicians. Understand? The faster you understand this thing, the better it is, so that you know what you have to do. Understand? Second important thing that is very important over here is to not take the first year lightly. It is the most important year out of all the years. Okay, you have to have an acquaintance with the different departments. Yes, everyone tells that you should have a basic acquaintance, what to do, what not to do. So the first year goes in acquainting yourself, but not only acquainting also means that you should observe what is being done so that you are ready to perform those duties in the second year. Now, some very important things that I have told you, that you cannot start your residency without reading Robbins. I am telling you again and again and again. Reading other books without Robbins is going to prove quite, it is not going to prove fruitful. Okay, it will be futile. So Robbins is the most important thing. If you watch my videos regularly, consistently every day, 3 to 4 months time is enough. Then, as I told you, normal histology, you have to read Beaters. And if you cannot read Beaters, it is also not a big problem. I am going to start discussing the normal slides inside our dedicated first year MD DNB group. We will have 5 pointer discussion for every slide. Common histopathology slides. What I mean that you are encountering on a day-to-day basis. Master those slides first so that you understand the ABCD of histology. As I am telling you the basics, understand what the blood vessels look like, how the nerves look like, what is fat, what is the lining epithelium. Unless and until you understand these basic things, you are not going to understand. For example, you are watching that, for example, they have written, okay, lymphovascular invasion present, LVI is present, or for example, vascular invasion is there, or perineural invasion is there. Now you don't know how a normal nerve look like or how a vessel looks like. How are you going to search for these things in the first year? Understand what I'm trying to say? So don't leap ahead, okay, before the time. Okay, in first years, we don't know anything, but we wish to know everything in the first year. Understand? It's a step by step process. Okay, so I hope I have made myself very clear. Common histology slide, common cytology slide. Now coming to the hematology section. Okay, let me make it very, very, very clear to you about few things which is very, 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 very important. Okay, and this has to start in the first year. It has to start mainly in the first year. So what am I discussing over here? I am going to discuss clinical pathology in details over here. Now, I will tell you over here, before I go any forward, the major book that I recommend for all the first year students is Kothalkar Clinical Pathology. Now, why do I tell you this book? This book, for example, it is not the best book for clinical pathology, but it is a very friendly book for the first years because the language is very simple and lucid. So as a first year, before you jump into Daisy Lewis or some other books, okay, it is highly advisable for you to completely read Kothalkar Clinical Pathology. It is a very, very good book. Okay, I'm not saying that it is a substandard book. It's a very, very good book. For example, if you read the Kothalkar Clinical Pathology, you will gain approximately 80 to 90% of the knowledge, and that is more than enough for your residency. If you get time, okay, for certain portions, the reference book that we are going to use is Daisy Lewis. So you have to have a hard copy of Kothalkar Clinical Pathology, and you should either have a soft copy or a hard copy for the Daisy Lewis. There are certain things which are given very nicely in Daisy Lewis. Okay. So what are the things in the clinical pathology that you should know in the first year? From the first year itself, you should know some things. Okay. These are very basic things. For example, when you go to a central lab or your clinical lab that you go, okay, central pathology lab. So over there, you will see that majority of the hematology slides are stained by one of the Romanovsky stains, that is the Leishman stain. Now I will ask you, what is a Romanovsky stain? You should be able to answer. There is a mixture of acidic and basic dye. So all these basic fundas, they are given where? They are given in Kotharkar Clinical Pathology. So that book is very, very essential for you people in the first year, that you should start reading and you should master that book starting from the first year. I'm not asking you to complete each and every point, but there are certain things that I am going to tell you that you should master in the first year. The first important thing that you see practically, what do you see? You see that a lot, all the hematology slides, they're stained by Leishman stain. Yes or no? Everyone. So all the staining procedure, especially the clinical pathology staining, the Leishman staining, it is given in Kothalkar, but it is also given in Daisy Lewis. So you see the procedure of Leishman staining in the Daisy Lewis that is given. You see what is the procedure, and just reading the procedure is not going to do. You should, in the first year itself, you should come and you should perform the staining, and you should keep on performing the staining till you become an expert in staining. Yes, this is very, very, very important, because if you yourself will not perform this particular slide, so at a later age, when you are going to work in some private lab, or even if you are working in a hospital lab, and if someone is not making the Leishman slide properly, you have to leave the report. You are the doctor, you are the end point. So in that situation, if you yourself have never stained the slide, and how do you expect to diagnose the problem if the medical technologists are not doing their job properly? So for that, you have to do the steps by yourself. And in the very first year, when you have a lot of time, you go to the lab, and while you're performing your duties, just do one stain. Just 4 to 5 staining, you will become an expert. But do it. We are lazy at that point of time. Not only you have to do the staining, but you should also make the smears. You should be able to draw the, how much quantity of blood I will take on a slide, where I will keep the blood on the slide. Then how am I going to make an ideal smear? All these things are given in Kothalkar in the peripheral blood smear chapter. You have to go and read those chapter. Okay, whatever you are seeing in the lab, you have to go back and read from clinical pathology book, and it is the most important book for you all. And why clinical pathology is important for you? Do you know why? It is important for exams. Okay, because it is the easiest portion, and this is actually going to form your bread and butter. So whenever you go and join a particular laboratory, okay, so all labs, they do not have histopathology setup, but all labs, they have the clinical pathology setup because it is easier to make. And once you have the clinical pathology setup, okay, so most of the works that you do in the clinical pathology is the work that you are going to start with post MD. Understand what I'm saying? So this is going to form your bread and butter. Okay, remember, clinical pathology is one portion which is the most neglected portion. Okay, this is very, 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 very important. Clinical pathology. Now, what is very important over here, if you look at the Leishman stain, so staining procedure, any staining procedure that you see in relation with your hematology, any staining that you have to do, okay, you should refer to Daisy Lewis, because that is the standard textbook. Okay, and you should follow Daisy Lewis for that. Again, you can follow Kothalkar as well. There is not much difference, but it is better that for any staining procedure you read from Daisy Lewis. Okay. Okay. Now, basic, as a first year, you have to perform central lab duties. So basic hematology slide evaluation. Okay, what do you mean by this? Basic hematology slide evaluation. What is the meaning of this? So you should be able to understand that how do you evaluate a particular slide. What do you see in the 40x? What do you see in the 100x? Okay, how you perform a differential counting. What is a normal slide? What is the normal percentage? What is a normal cell count? How do you get a rough idea of the cell count by looking at a particular slide. Okay, or how are you getting the differential count? What is the method, correct method? Okay, so you cannot always take a DC counter and you will sit and you are going to do, very that you are going to perform DC for every slide. So sometimes you have to, you have to screen more than 50 slides in one day, or more than 100 slides also sometimes you're given. So you cannot have that much time. So you have to develop your algorithm of evaluation of a particular slide. Understand? So this is going to come with time and practice, but basic hematology slide evaluation is very, very important. So for example, you have to understand whether a particular slide, whether it is a reactive slide, or whether it is any kind of myeloproliferative disorder, or it is a lymphoproliferative disorder, or for example, the particular slide, if that is that of a leukemia. Understand? So majority of these slides, they are normal. You have to write certain terms. What is mild shift to the left, or for example, presence of any reactive lymphoid cells. These are very basic things. Now, this is not something that I can teach you or any pathologist can sit and teach you. No, this can only come with practice. The more you are going to see the slides, the more you are going to understand the different features that you see, the more you can correlate. Now, first, very important thing, you should be able to recognize what is a neutrophil, what is a small lymphocyte, what is a large lymphocyte, what is a monocyte, what is an eosinophil, what is a basophil. So these basic things you have to understand for. And how is going to come? You can never master the differentiation just by looking at the books. No, you have to see the slides, and only when you see the slides for more than 50, 60, 100 times, you see different slides, 100 different slides, that you are going to get a basic idea that which are what cells, which cells should be in which proportion, which slide, you feel like there is an eosinophilia, which slide you look like, there's a lymphocytosis. Now, also very important, you should know the age groups. For example, in children, a high lymphocyte count is normal, but in adults, the same high lymphocyte count is not normal. In that case, you should think in terms of chronic lymphocytic leukemia or CLL. Just I'm giving you a point. So basic hematology slide evaluation is very important. Again, in Kothalkar, you read the chapter of the PBS, peripheral blood smear chapter. You should read in details so that you understand this point. Okay. Now, very, very important, you should read from Kothalkar only. You should read in details individual parameters. Now, every day you are going to the lab and you are signing off reports, you are seeing that there are lots of parameters. For example, they start with the hemoglobin, RBC count. Okay, then you see the indices, MCV, MCH, MCHC. Then you see basically the platelet count. Okay, WBC count, the differential, RDW is there, then the retic count is there. Okay, so basically I'm just trying to tell you that there are different parameters in your report. Now, if you go through Kothalkar, each one of them, they are a separate entity. Now, as a pathologist, this is the bare minimum that you have to know what you are reporting. They have some significance. Now, if you are just reporting the slides without knowing the significance, then it has no meaning and it has no use. Okay, very clearly I'm telling you have to read each of these chapters from Kothalkar, and trust me, Kothalkar Clinical Pathology is such an easy book that it doesn't take a lot of time to read these things. These are very, very nicely given in Kothalkar. Okay, then after that, for example, one more thing that commonly we are doing in the clinical pathology is malarial parasite evaluation. I have even shared some of the very important live and very important slides showing the trophozoites of Plasmodium vivax and the ring forms of Plasmodium falciparum in the group. So malaria evaluation is also very important. You should know how to prepare a thin versus thick smear. Okay, you should know how to prepare thin versus thick smear. Okay, so you have to read that, and when you go, and I will tell you who is going to teach you these training procedures. The medical technologist is your best friend over there, that you should always have a good relation with them and you should try to learn whatever they are doing. So a good technologist, okay, if he is famous, if he is known, you should go and learn from that person how to do the staining procedure. Okay, how to do the thick and thin smear. So this is very, very, very important for you, clinical pathology. Okay, now what is very important, one another very important chapter that you should read from Kothalkar, that is qualitative qualitative and quantitative WBC disorders. Qualitative means if there is any defect in the neutrophil function or WBC function. So there are multiple disorders. Okay, a separate chapter is also given in Kothalkar. And quantitative, as you know, which are the conditions where there is when you will call it a particular condition as leukocytosis or there is leukopenia. For example, what are the conditions associated with neutrophilia, neutropenia, eosinophilia, lymphocytosis or lymphopenia. So you should know all these conditions should be at the tip of your tongue. Okay, this is very, 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 very important. Again, in the clinic, we are continuing clinical pathology only. Under the clinical pathology, very, very important thing that you have to understand is the fluid evaluation. We will have separate classes for this and separate videos will be loaded for them in due course of time. But fluid evaluation is of utmost importance, wherein you have to do the cell type, cell count. Along with that, you have to write, you have to comment on the M cell if there is any malignant cells that are present on. Yes or no, everyone? So what are the different kinds of fluid that you receive? Commonly at night, if you have duty, you will receive CSF fluid. You will receive the pleural fluid for evaluation. Then we are having the ascitic fluid for evaluation. Apart from that, we are having synovial fluid for evaluation, or you can also have semen analysis. Now, mind it, whatever I have written over here, these are commonly performed in outside labs. So if you want to get ready for working in outside lab, you should be able to do the cell type, cell count, and you have to comment on the M cells as well. Understand? So this is very important. Fluid evaluation is again a part of clinical pathology, and you should be very good at it. Another very, very, very important part that you have to know in the first year is urine routine examination is a must know, and you should be able to evaluate the routine urine smears. You should know what the RBCs looks like, what are the cast and crystals present, what is the pus cells, how much is the pus cell count. Okay, so this is whether any microorganisms are present or no, or you are having any kind of significant features in the urine or no. So urine routine and routine examination is very important. This will be covered, and the videos for the same will be uploaded in the website. Okay, now apart from that, this doesn't stop till here. When you are going one laboratory, in a medium sized lab, they are not going to keep a separate pathologist, a separate biochemist, and a separate microbiologist. No, they are not going to do that. So you also have to be acquainted with the biochemistry test. For example, the LFTs, okay, the renal function test, thyroid function test, then test for detection of diabetes and monitoring diabetes mellitus, then heart function test. Okay, so cardiac function tests are also there. Then there are certain tests, okay, for detection of pregnancy. Okay, so pregnancy kits are available. Okay, so you have to read about all the different kinds of tests that we are doing to to evaluate these parameters. Understand? So this is very, very important, and I'm not saying that in the first year itself you have to know each and everything. No, it is not like that, but at least you have to start in this particular direction, that you have to cover them. And these four things that I've told you: Leishman staining, basic hematology slide evaluation, parameters, as well as the MP evaluation, this should be completed in the first year. By the end of first year, you should be able to do these basic things. Okay, is this point very clear to everyone? Okay, and also the urine examination, fluid evaluation, and interpreting the biochemistry reports. So is this point very clear to everyone? Yes or no? Yes? Okay. Now, after this, so we have now discussed the clinical pathology portion and what is the importance of clinical pathology portion in the first year. So it is a very important part of being a pathologist. Now, the next very important point that I'm going to discuss, it is psychological counseling of the first years. I will just tell you why. Psychological counseling of first years. Now, I will tell you, I have had students from the second year, from the third year, and I've also had students from first year. Now, I'm going to, tell you something. As a, if I'm just trying to tell you something. One very important thing is that as a first year, okay, I used to think that first years are the, easiest to deal with, but it was the opposite. The second years and the third year, they were more calm. And the first years, they had a lot of apprehension, lot of doubts, and lots of things going on in your mind. And I am sure you will be able to correlate the points that I'm going to jot down right now. The first important thing that a first year thinks, the first year wants to impress, okay, impress the professors, okay, or for example, any kind of teacher or faculty. Okay, now there can be many reasons of impressing, but most of the times the impressing nature to the reason for impressing them is the fear to fail, or fear to be insulted. And we are living in India, and we are very unlucky in this portion that yet our medical system has not evolved to that level, wherein that the faculties, they they should consider you, and they should treat you in a very equal and disparate manner. So this is very much lacking in our Indian system, not in all the colleges, but in majority of the colleges. So please do away with this idea that you have to impress everyone. You have not come here to impress anyone. You are just over here to be a pathologist, to learn, to gain the information. Okay, having said that, I'm not going to tell, it is not that I'm telling you to go and fight with your professors. No, I'm not telling you to go and fight with your professors, or, to be very upfront with them, or to, fight for your rights. No, but this is not what you are here for. The professors, the teachers, everyone is going to take you down. Everyone is going to insult you in some or the other way. And that is a part and parcel of this process, not only in the first year of pathology, but first year across any department, whether it be clinical, non-clinical, anywhere. Okay, so this is just a part and parcel process. What I see, I've come across students that they are psychologically terrified. That should not be the case. Okay, you should not take anything seriously. So what happens over here, I will tell you why is it important, why am I spending this much time, okay, on this. I will tell you. Now, for example, you will have routine activities or academic activities like seminar presentation, JC topic presentation, or some of the other things are going to go on. If you stand beside a faculty, he or she is going to ask you some question, he or she is going to grill you. This will happen, I am telling you, and 80 to 90% of the times you will not be able to answer, because I will tell you, this is the fact. They are asking questions not because they want that you answer. If you answer, then they will become sad, because this is some way of enjoyment that they have. I'm very sorry to say, but this is the reality, and I ask you to become practical on this basis. So please do not go on to impress any teacher, professor, anyone, but on the same time, you do not have to be in anyone's bad books. You have to be neutral like a water. You have to be neutral like water. You don't have to react at all. You just have to keep on learning. Having said this thing, I am assuring you that when you are doing a time management, when you are doing time management for first year, I hope that you do not spend all of your time and energy just for doing your routine college work. Please, I see students that they do not get time to watch the videos. They are not concentrating on any other thing. Just they are concentrating on what the teachers are saying, what they are saying. I want to impress this teacher, that teacher, so I should read from this book. I will read from that books. That teacher is, asking this question is so much advanced. This is not going to help you. I'm not saying that you shouldn't spend time on that, but you have to divide your time in the first year between your college work that includes impressing teachers, reading for certain small exams, or presenting seminars, or JC topic discussion, or any, for example, sometimes you have slide examinations, and then, based on the slide examinations, you have certain tests in your college. So that is your college work, and every day you are bound to spend 1 to 1.5 hours for this college work, not more than that. But majority of the time should be based on basic your basic course, your basic Robbins, your basic cytology, basic slide discussions. This is this is how you have to divide your time. This thing that is there, this should be constant. So every day, 2 hours have to be spent for your MD pathology course. So that includes everything. And what I believe, if you ask me, first day in the morning before going to college, you complete this portion. That means you read Robbins, you read some part of hematology, you read some part of cytology, you read some part of tissue processing, or you read some part of grossing. These are the things that you have to do on a daily basis. Okay. With that, sometimes when it is required, you have to give some time for your college work. But I'm very sad to say, majority of you all are spending the time over here in this college work. That is of not, I'm not saying they are of not much use, but that is going to hamper your study pattern. So this has to be constant and you have to take out time for this. It is not like that, no, tomorrow I have seminar presentation, my mind is not free. Every day something or the other will be there in department. Okay, that doesn't mean that you will leave, your routine study. So this has to occur in addition to your, to your basic core study. You have to keep that in mind that every day I have to invest 2 to 3 hours on myself, reading Robbins, reading basic hematology, reading cytology. So is this very very clear to everyone? Okay. Now now having completed this basic orientation, what I want to tell you, I will be discussing each and every part now. For example, I will first start with the cytology. Okay, now already I'm not discussing which books you have to follow or not to follow. That has been discussed in the orientation class only. But what you have to do in your cytology postings, the things that you should know, you should be a very good observer. Okay, you should see what is going on in the cytology room. There is a medical technologist, there are certain students, medical technology students, they are doing something, they are writing with the glass marker. There is some doctor, there is a first year, there is a second year people, they are performing the procedure, first year is writing the details. Everything is important. In the first year you are taught, you should understand in the first year, as a first year you should understand the importance of history taking. Okay, you should importance how to take a proper history of the patient. You should understand how to examine a patient, how to elicit the history, how to rule out tuberculosis or other conditions, how to examine and how to describe a particular swelling. So these are the things that you should understand in the first year. Having said that, you should have performed certain FNSE procedures has to be performed by you. Not many, maybe 4 to 5, but you should be acquainted with the process of that. Okay. Very importantly, there are certain stains that is done in the cytology. PAP stain, acid fast, AFB stain is done. That is the ZN staining is done. MGG staining is done. So practically, you should be able to perform this staining. Now, in a year, maybe sometimes 2 month, 3 month, you are posted in cytology. So you have to know how to stain them, how to do them, how to perform this staining, how to do the staining. What is the importance of PAP? What is the importance of MGG? Why ZN stain is done? So you have to understand these things over here. And along with that, you don't have to complete all of cytology, but you have to cover up all the major systems. All the major systems you have to cover. For example, you should be able to, report the fluid, or you should be able to see or examine a fluid slide. For example, you're getting a pleural fluid slide or ascitic fluid slide. Then how do they report a slide? How do they describe the findings? Okay, so you should be able to identify and you should be able to write, see whatever findings the professors of faculties have written. Okay, whether you are getting everything in the slide or no. So fluid reporting is important. Then you have to read about the breast cytology in details. Thyroid cytology should be familiar with in the first year. Salivary gland cytology. Okay, along with that, lymph node cytology, you should be able to understand. The cervical cytology, both the normal cervix, along with that, the pre-neoplastic and the neoplastic conditions, the malignant and the benign conditions, you should be able to identify. Lung cytology. So these are some of the basic cytology systems that should be covered. Having said that, all the videos with regard to basic cytology is given in the website. Again, you have to just go download the PDF, hear it, and then perform when you are performing the procedure inside the college. Is this very clear? what you have to do in cytology, all the major system should be done. You should be a good observer. You should be able to do the PAP and the MGG staining. You should know basics of the procedure should be known, and details of the history taking, and taking consent from the patient, describing the lesion, writing down the patient details. Okay, that is very, very, very important. Okay, now after that, hematology. In the hematology part, let me tell you what you have to do. Now, already I have spoken to you that you have what you have to do in the clinical pathology. So a lot of hematology section is covered there. But if we have to see what are the things that you should be able to perform in the first year. If you are posted in the first year, you should be able to carry out bone marrow aspiration procedure. Okay, at least not the biopsy, but at least the aspiration procedure you should be known. Not only that, you should be able to collect the blood. So blood collection from the veins is very important, that you should understand how to collect a blood sample. Now, how to make a smear from the finger prick. Okay, it is not something I'm giving you an ideal thing. No, these are things which are important. These are performed on day-to-day basis. And if, for example, a medical technologist is not available, you are expected to perform these procedures. So that is why when you are a student in the first year, these are the things that you should learn how to do. Now, coming to the theory part of hematology, as I've already said, that RBC disorders, okay, could be completely done. Okay, again, each and every RBC disorder video is given in website. You just have to open, download the PDF, see the video, and revise the video. And the way that I have taught you, I have cleared all the concepts and details, so you don't have to waste a lot of time thinking or trying to understand the topic. And if you have any problem, I am available 24/7. You can write to me. Many students, they write to me about doubts throughout the day, and I clear those doubts within 24 hours. Okay, maximum 24 hours. Okay, now apart from hematology comes very, very important thing, that is the grossing. Now, grossing is something that cannot be taught theoretically to you. You have to learn by yourself. What is grossing? What is grossing? Okay, grossing is something that you have to perform yourself. Now, you should be able to write down the findings of the grossing. You should be able to perform the grossing procedure. Now, what is the basic idea regarding grossing procedure? That you have to take a representative section. Okay, because if you have not taken a representative section, then you cannot properly evaluate. So for proper evaluation, a representative section has to be taken. And for grossing, as I've already told you in the Telegram group, we are having this Tata manual. Okay, the Tata manual of grossing. Now, as you are doing the different grossing, for example, you're doing grossing of uterus cervix, breast, or colorectal carcinoma, or sometimes Whipple's can come, mandibulectomy can come, or certain biopsy specimens are there, or for example, ovarian cyst is there. So different kinds of specimens are there. You should always know what is the pre-gross, what is the pre-grossing procedure that is done. Then on the day of grossing, what you have to do, that you have to perform, and that for that Tata manual is very important. Over a period of time, okay, January onwards, we are also going to take out videos to help you understand the grossing process. Okay, and to make you understand what is the importance of grossing and what questions can come from this portion. So you have to read the Tata manual, and in the first year you should be able to perform. Very important is to start observing. The second year is going to do the grossing, and you have to at least observe. Then the way they are describing a particular specimen and what they are making you write, it is only going to come by writing 2 times, 3 times, 4 times. So it is not a waste of time. It is a time of learning, because next year you have to teach the same thing to your juniors. Understand? So this is about grossing. Now, very, very, very important thing that is there is your dissertation. And for that, you have to submit synopsis. Now tell me, how many of you have already submitted your synopsis, or you know what is a synopsis? Yes. Yes, tell me. How many of you have submitted? Okay, so you have submitted, so you understand what a synopsis is. Okay, so this is a part of your curriculum, dissertation, or thesis. So for that, synopsis is something where you are giving a basic idea, okay, to the college board or to the university where you are submitting your synopsis, that you are giving a basic idea of the study that you are going to do and the way in which you are going to perform your study. So there is a particular format for that, and every university have their own rules and regulation. Certain ethics is there. You have to get clearance from the ethics board. So for synapses, you go through the previous 10, 15 years or 20 years, you go to the website and you see what are the topics of the thesis that is being done. So you just change certain words and linings and then you perform the same thing. Or you might do some novel test only. And everyone is assigned a particular professor who is going to, assign you how to perform or what to do or what not to do. So that is there is a little bit of research work. Now, if I am not wrong, there is a particular workshop or there's a particular small course that you have to perform, that you have to do. And I'm forgetting the name of that particular process wherein you are taught how to do the research work, how to do the statistical analysis. So those things are basically a part of that process, and the details of that particular workshop or the details of that. But I think that has been made mandatory by the National Medical Council, and every resident now have to give that exam, I think. I will let you know about the details of that exam, okay, in the group later on. But just remind me, because that is compulsory now. I think that every student who is performing a thesis has to attend that particular workshop. Okay, so I will tell you, it is online only. I will let you know about that. But synopsis is a good part of your first year, which usually takes minimum around 1 to 2 months time goes in preparing your synopsis. But again, when you are making your synopsis, it shouldn't be that you are making your synopsis and you're neglecting your routine basic work. So this has to be done continued along with your routine work. Routine work means routine hematology studying, routine cytology study, routine Robbins general pathology studying. This is very, 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 very important. So you have to take time for your synopsis as well. And if you have not submitted your synopsis, it is high time that you do the same, because you will submit to the ethics board. They are going to pass, and then it is going to be completely submitted, and then you can proceed. It is giving you a green signal to proceed towards your dissertation. Yes, yes, everyone. Is it clear? Okay. Now, one very important thing that I always say, okay, I've also said in my, orientation class, please, okay, if you are not going through the exam questions, at least you arrange for the last 5 to 7 year question papers of your university. I cannot, why I tell you what is the importance of these questions. When you read the questions, it is as if you are going to understand what is it that is required out of a pathologist. Why the questions are framed in such a manner. Okay, if you go through the questions that are asked in a second year MBBS versus those in MD, you are going to differentiate, you are going to understand what is it that is required out of us, what is it that we should be competent in. That is why these questions are very, very important, because these are mostly related with the practical world. Okay, understand what I'm saying? So at least if you are not solving the question papers, at least you arrange and you find all the question papers and you keep that ready. It should not be like, you are, wasting time, and then in the third year when the exam is near, you are going for the question paper. No, from the first year itself, you arrange for the question papers. Okay. So is this point very clear to everyone? Yes. So this is all that, as per my, as per my thinking, this is what a first year should be able to understand. This is what a first year should be able to do. Okay. I think this is enough that I have spoken about so many things in today's lecture. Now, kindly tell me, any of you are having any kind of doubts with regards to your residency or with regards to your journey that I should explain. So this is the time. Ask.